I am personally very impressed to find committed staff on duty, to find a very clean hospital environment, to find the administrator in his office. The administrator was able to take us around all the wards, all the departments, all the sections, and we found staff there readily serving the people. We went to the pharmacy and we found drugs, and drugs are being dispensed to the people. We went and found nurses waiting for mothers to bring children for vaccination, which is very rare. There are times you go out for such visits and you find patients are there waiting and lamenting and there are no doctors. But here we are. We started from the emergency section and we found a standby doctor within the hospital ready to attend to the emergencies, and we moved around and we are very impressed with the level of service delivery in Moyo. We found a very clean hospital with terrazzo and everywhere sparkling clean with committed staff, which is very impressive. It's different from the picture we keep hearing and the complaints coming in and so on. So this is very good and commendable.
Over 100, I think 160. And also that CBC machine breaks so often. It is old, it has taken over 15 years. They scream, after screaming,
Lack of the storage facility. I think the Ministry of Health needs to take that up. We will take it up with the Minister for Health and ensure that Moyo Hospital gets a facility to help them store the blood. The other challenge they have is the blood has to be taken, if people have donated, has to be taken to Arua for screening. So they need to be facilitated to ensure that that screening is done very fast and blood can be readily available in the hospital. And once that storage facility is put in place, then they will be able to have at least blood to handle emergency cases that come to the hospital. The private wing has very few drugs, and the pharmacist in the general wing says the private wing patients come to the general wing to get drugs. So what does that say? That says the hospital is basically not discriminative. Even the private patients can access facilitation, medical facilities and drugs from the general wing, which is a very good thing and highly commendable. I found that the general wing has got more staff, more manpower than the private wing, and the private wing is optional. Anyone who wants to go there and pays 20,000 per day, it is optional. Just like when you take a flight, you may want to go economy or business class. Now the people who opt out and go to private wing are attended to, and they pay a minimum fee of 20,000. If they stay on beyond 5 days, then it is halved to 10,000 per night, which I think it's a very good thing and highly encouraged. So I'm very impressed with the Ministry of Health maintaining such a facility here in Moyo.
The wing is for those who can afford and are willing. Nobody asks you to go to the private wing. But if you think you have the money,
then they can go and buy as per your prescription.
Exactly. Okay. But there are medicines that, for example, attachment anti-malarials, we have in plenty. Okay. We have instructed the private wing not to buy, to stock anti-malarials, because these ones can expire for no good reason. So if you, a private patient, you go to the private wing and you require, for example, anti-malarial, you will be given for free.